Hi Melanie,
Hi, Andy.
thanks very much for agreeing to do this interview with me. Can I
Pleasure.
ask you to start, thank you, can I ask you to start by introducing yourself please?
Yeah, sure. I'm Melanie Craig. I'm the Chief Officer for Norfolk and Waveney CCG. And I think I should mention too that I'm a mother of two teenage daughters and a dog, just in case there are any interruptions, but hopefully there won't be, Andy.
Thank you for the warning. Melanie, we've got 4 questions for you, and the first one is what I ask everyone, and it's this. So how are you looking after yourself during this pandemic, and how are you supporting your teams?
Yeah, great question. I mean, supporting the teams, I feel like we are supporting our teams like in a way that has been better, and there are things that we should have been doing more before. Things that come to mind, particularly around flexibility. We've had to inevitably be as flexible as possible because we're asking the same from staff, to be as flexible as possible. And people are working in extraordinary conditions. Either our CCG staff are working from home, or we have deployed them to work alongside frontline staff. That has been our sole focus during the COVID pandemic, to support frontline services. So being really, really flexible. I think communication has been massively important. Of course, we've had to communicate more frequently, really trying to encourage teams to check in and make sure they make contact with their staff as often as possible. And we've tried to develop lots of different ways of communicating with our staff, just to keep reaching out to people and involving them. And that has, through, we do a weekly staff briefing session. We get over 200 staff join virtually on a weekly thing. We try to make it a bit fun as well. So as well as giving information, and maybe we'll ask one of our CCG staff to co-present and to introduce themselves, to get to know each other. We often have little videos as well. So for example, we're loving have you seen the Olive and Mabel, the dogs, on YouTube? We're loving that. So try and have a bit of fun things as well. And as well as that for staff, we've done a lot, of course, and continue to find different ways of really reaching out to people's mental health. So we've had lots of apps. We've promoted lots of the apps right at the beginning of the pandemic, like Unmind and Sleepio, and apps like that, as well as other things too. So for example, today actually we've got we've involved a specialist GP actually from Nottingham, who is going to run a session for all of our staff virtually on looking after themselves and mental health for an hour. So things like that for staff. And we continue to try and do lots of different things too. For me personally, I've had to, like everybody, I guess, just establish a different routine and a different rhythm, because we're working, I'm mainly working from home. And so I've found in some ways, whilst the work is even more intense than previously, actually I'm finding I can exercise more. So Andy, if you get up early enough, you'll see me running around the park. So I'm enjoying running more, which is really good. And I also we have an allotment, and I've spent every single weekend from lockdown, when we were really fortunate to be allowed to go to allotments. I would say I'm now more than a partial helper. I'm more of a co-owner of the allotment. So I'm really enjoying. That's been like a lifeline for me. So. And just really simple things, spending time with my family, a bit of baking, like lots of people. But that's probably it for me.
I think it's easy to forget that CCGs, for example, have redeployed so many of their staff during this time. I really like the fact that you've got the opportunity now, as so many others have, to bring together the wider team, whereas it may have only happened maybe once a year,
Yeah.
maybe an awards event. This can happen more regularly. That's great. And I'll need to buy some of your vegetables at some point.
Yeah, sure.
The second question I have for you is this. So can you tell us about some of the most important changes or new services that have been introduced in response to the pandemic?
Yeah, no, it's very interesting. And of course, I mean, there's still services that are emerging, and we're still reflecting on what is new and what has changed. I mean, this may surprise you. I'll call out care homes. I mean, it took us a while to organise ourselves, I think, the wider NHS, and connecting with social care. But I think our service to care homes is now way better than pre-COVID, and rightly so. These are some of our most vulnerable people in society. And I think, we didn't have a service that was well supported. It was quite inconsistent and quite reactive. And I'm really proud now that we have much better connected service for care homes. So our GP services are much more proactive, and also our CCG nurses. We have CCG nurses going in, fit testing staff, giving infection prevention control. So I know care homes will be much more proficient at infection prevention control now than pre-COVID, and the services are much better joined up. In addition, the response from our community nursing service. So we've been fortunate in Waveney. We've had a very strong local testing offer. So when we've needed to, staff and residents have been tested through our community nursing service going in to test in the care homes. And that's been a great addition. So it will continue to improve, I'm confident, but it is a much better service than pre, and rightly so. I think also just mention, I'm so pleased about the response to homeless and rough sleepers. Nationally, I think it was a very important policy. And I know in Lowestoft, the CCG has been really pleased to be part of the work along with Lowestoft Rising to support rough sleepers. And we love that, and it's so important that continues after the pandemic moves into a different phase as well. So I think that is again, it's continued to strengthen. I'll also mention mental health. It's very interesting. Whilst we have set up very rapidly a new 24/7 mental health advice line, which I'm sure you will know about, and also then a specific one for children and young people called Yacoub. As well as that, I know I joined a focus group that we had for mums in Lowestoft last week and listened in on that. And it was mums of children and young people who were under 18. And they talked about their experiences during the pandemic. And I was really heartened that not all, but so many mums were using apps and self-help more than I think would have done pre-COVID. So not for everybody, I know, but I think there is more people who are using self-care and self-help apps, particularly around well-being, which is a good thing. And then I guess I'll finally just mention, I mean, I'm sure others on the call have called out digital. It's like finally the NHS is better connected and using 21st century technology, finally. I mean, it's been an absolute revolution. And it doesn't suit everybody, but lots of people are finding just the way you can get more contact through your GP practice and through outpatients. I mean, the James Paget Hospital, for example, went from like 0% increased to 500%. It's outpatient appointments, that they're doing not face-to-face, which is transformative. It doesn't suit everybody, I know. We must just, continually listen to people where it's not suitable for everybody. But for many it is, and I'm really pleased about that.
I'm glad you referred to the plight of care homes, especially in the first month or so, which was a critical time, wasn't it?
Yeah.
And you've also mentioned mental health and children and young people and their families. There are key priorities, and homelessness as well. And as you quite rightly say, also, unless we learn from what worked well and carry that forward. What's the point of having actually made a difference during the last 3 months, for example? So thank you for that. And you're absolutely right about digital. It has transformed, and again, let's make the best of that in reducing transport, travel time, wait, and so on. Absolutely.
Yeah.
Thank you for that. So my third question is this. So thinking about the local NHS response to COVID, what are you most proud of and why?
Wow. So many things. I mean, I think overall, it's just probably top of the list is how incredibly selfless and compassionate people were. People were just, they moved like the clappers really, really fast, Andy. That was impressive because often the NHS is criticised. We take years to do anything. That's often a criticism. So we moved really, really fast. But people were just so brave and so selfless. I mean, I think about Susie Vaughan, the nurse from King's Lynn, who spent 45 days away from her 2 young children, her 2 daughters, and they were reunited on TV, which is an intensive care nurse. And, there were so many acts like that. It was just, so humbling. It was a very, very hard time for people. And I suppose, again, how flexible people were. They're willing to just do whatever was necessary for the greater good. And, that's why I joined the NHS. It's for the greater good. That's why I think a lot of people are motivated to work in the public sector. But that really tested that value. And we saw people deployed. I mean, we have a little team of CCG staff now that are in charge of our PPE supplies for general practice. In fact, that's what we're using one of our big offices for, is for storing PPE. And these were a group of staff. They're accountants, they're people who used to administer meetings, and we had them in charge of coordinating PPE. And of course, the NHS response, I'm really proud of too. I mean, we couldn't have done this without all of the support we had from the voluntary sector and the communities. And so, sometimes I think the NHS doesn't embrace that well enough. And we really did. We had to, and we did. And people came forward with the most amazing offers. So we saw schools making visors, we saw community groups sewing scrubs, and it was just overwhelming. And so I was proud of the NHS in accepting these great offers and showing how important they were. So the population and the communities were involved in this. And yeah, I mean, the PPE response in the early days, that was very concerning, particularly for the smaller providers. And so it was fantastic that we were able to accept the support from the communities and respond. We had little teams of people driving out all over Waveney with PPE, delivering it. One of the community offers we had too, Andy, was which of course I had to accept, was Norwich Football Club offered their community bus to drive PPE around to our practices, which, as Andy, you'll know, I'm an Ipswich Town fan. I accepted that offer. And very gratefully, but yeah, no, seriously, it was wonderful of the club to do that. So, yeah.
That hurt, didn't it, Melanie?
yeah. I had to dig deep on that one.
No, you made some really good points about collaboration, which was absolutely necessary, wasn't it? And also about working outside of your comfort zone, doing something different to what you're used to doing, just to get things done. Brilliant. My last question is this. So what learning or challenges do you think will come from this outbreak?
Yeah. Well, I mean, we're still very much in it, of course, and we've got time to learn from this first period. I think my learning is staff. I know NHS staff have felt more valued than they ever have before in this. All staff have felt really, really valued. And that may be a strange thing to say, but generally, it can be quite hard. And I think the NHS in turn has valued its staff better too, very much. Even from the support, we've seen in hospitals actually, and we heard from staff that for the first time in people's working lives, they've actually had food and water during a shift, which is quite shocking to think about. But actually, during the pandemic, clearly we've made provision to ensure staff are at least getting fed and taking proper breaks. So I think we've looked after our staff better. And we're also I think we're more in listening mode now. So I think the learning for us is we need to continue to be in listening mode, because we haven't got this right for everybody. There have been lots of tragedies through the last few months. Lots of people have sadly died. And the approach we've taken as a service has been a uniform mass approach. And we had to in the early days, I think, because we were absolutely in crisis. The stakes were so high. And this was, we'd never been in a situation like this ever before. But we know that the response didn't meet everybody's needs, and staff as well. So particularly call out staff from Black, Asian and minority ethnic backgrounds. I mean, we say minority, but the paradox, of course, in the NHS is that often staff from Black and all the many, many different Asian, African backgrounds are in the majority in the NHS. So it's a bit of a paradox. We are listening better to those staff, needing to protect them better. And I think that's a really important learning for us, listening to people's experiences and understanding what we need to change and how we need to respond. And particularly, that goes through into the communities as well. We know we haven't got this right for many of the communities that are from Black, Asian or more minority ethnic groups. And so my hope is that the experiences we've had during COVID really signal a change where there's more action taken to support those communities, and that we listen and we have a more nuanced and focused response that that will work for people rather than just a mass approach to doing something. So yeah.
Thank you. That's a good note to finish on, Melanie. Thank you very much for your time.
You're very welcome, Andy. It's lovely to see you.
Thank you.